Welcome to the Ask Dr. Deanna show. I'm Dr. Deanna Holdren, your host. Join me weekly as I cover various health-related lifestyle medicine topics that you get to request. This show is for anyone who wants to proactively improve their health position. I hope you enjoy the show. Hey, everybody. Thanks for plugging in today. I am very excited to bring you part 2 of our COVID series. If you were with us last week, you probably noticed that I was feeling a little under the weather and I felt like I had to cut it short and that I didn't really get everything out that I wanted to say. So I am going to kind of go over or repeat some of what I have done for COVID to kind of help from the standpoint of, just maybe getting over it more quickly, that sort of thing, and also cover a few other things that I was not able to talk about last week. So let's go ahead and jump right in. So first of all, I mentioned last week that I am a big advocate of something called NAC, which is N-acetylcysteine, NAC. It's a supplement, and it is a supplement that is commonly used to help boost the immune system by boosting glutathione levels. And it has, results in the COVID world. And it also is something I always like to say, if somebody's got asthma, they may need to be a little careful with it because sometimes it can trigger a little something there. But for the most part, for most people, they do really well with it. The other supplement is quercetin, sometimes called quercetin. And quercetin is what we call a zinc ionophore. It helps to basically get zinc inside of the cell, and that is going to help from an antiviral standpoint. The vitamin D, of course, the vitamin C, and the zinc. I don't think I talked about the amounts last week, okay? I don't think I hit that. Now, Orthomolecular, which you guys know is a company that I like, a brand that I like, Orthomolecular has a product called Orthomune. And Orthomune kind of rolls all those things into one. So it makes it a little bit easier. It's probably less expensive too, because you're not buying, 5 supplements. You're basically buying one. But Orthomune has the NAC, 600 milligrams per dose. It's got quercetin, 250 milligrams per dose. Vitamin D, 2,500 IUs per dose. Vitamin C, I believe it's 1,000 milligrams per dose. And then zinc, 25 milligrams per dose. So it has it kind of all rolled into one, which is really nice and a lot more convenient for a lot of people. But basically what I have recommended to my patients, I have a little handout that I give them. If somebody calls in, they've tested positive, what should they do? And, I talked last week about, of course, no sugar, plenty of rest, plenty of fluids, making sure that your body is hydrated. All of those things are absolutely key. But also, if you've got the sore throat, even if you don't have the sore throat, a great idea is to either do warm saltwater gargles, or I actually like to mix peroxide 50-50 with water. So half peroxide, half water in a cup, and gargle that about every hour. That's going to help to reduce some of that viral load. The other thing is there are some products out there available that basically are like an iodine for the nose. It is a drop. You basically squirt the drops onto a Q-tip, and it's meant for you to just kind of swab the inside of your nose. This can be used if you are sick, but it also can be used if you're traveling to basically try to just clean that area and keep anything from landing in there. It's not going to like that environment if you've got a little iodine swab that has just happened, and then also cleaning it, it's going to make a difference. So a lot of people have done that and had some great results with that. I know for me, I also have used a little bit of a colloidal silver gargle as well. But for me, I was absolutely, in a sense, I was really nervous. The first time I got COVID, I was afraid. Some of you who have had Omicron have had this intense, severe, horrid sore throat. And I was quite afraid of that sore throat. So I gargled every hour to prevent that. And I actually didn't get it at all. So anyway, that's something that you can do. And then the NAC, so that Orthomune supplement, that's something that I usually take daily. And that is a supplement that the orthomolecular put together since COVID has happened. But when I had COVID, so when I got sick, I increased the frequency. So I took that NAC, the N-acetylcysteine, 600 milligrams 3 times a day. I took the Quercetin, 250 milligrams 3 times a day. The vitamin D, I increased my vitamin D to 10,000 IUs a day just while I'm sick. Okay. You don't keep taking that amount unless you need it. Okay. For some of you, you actually need that amount, but just while you're sick, and then you reduce it back to your normal dosing. Make sure that you're getting outside and getting some sunshine too, because that's going to help as well. Vitamin C, I increased that to 1,000 milligrams 3 times a day. Zinc, 50 milligrams daily. We also have had a lot of reports of people using melatonin, and that's anywhere from 5 to 15 milligrams daily, and I would say just as tolerated at bedtime. And then an aspirin a day. Initially, when people get sick, okay, there is a viral phase. Okay, you've been infected with a virus, and that kind of acts a certain way. Okay, and for some people, they have very mild symptoms in the beginning, and then it starts to get worse, after about day 5 or specifically day 8. And then some people do, they're sick right away in the beginning with the fever and the chills and all of that. That's your body's response trying to basically get rid of that. Okay, to make an environment that the virus doesn't like. So it's basically creating this heat. That's a fever. Now, if you cannot tolerate the fever, okay, or it's super high, then by all means, take something to bring it down. I typically have recommended even just taking 1 ibuprofen. I don't like using that medication because it can mess up the gut and so forth. But in that instance, I would use it. I prefer that over Tylenol because Tylenol actually can decrease your glutathione levels. And glutathione is this potent antioxidant that's going to really help fight, this virus. So this initial phase is this viral phase where I've got this virus. And then after that, usually around day 5 to 8, somewhere in there, it's almost as if there is this inflammatory phase. Okay. And everybody's different. I mean, you could have it happen, move through these phases very quickly, or it could be this process, but there's this inflammatory phase as well. So when you look at COVID, we've got viral phase, we've got inflammation. Okay. Where in a sense, you're having an allergic reaction to whatever that is. Probably the spike protein is what you're having an allergic reaction to, but you're having an allergic reaction. And so that's where those steroids come into play. And we've seen from, great results with inhaled steroids. We've seen great results with oral steroids. And certainly I know our local urgent care here, if somebody tests positive, it is not uncommon for them to prescribe a Z-Pack and a steroid dose pack. And the reason for the Z-Pack, and that's an antibiotic, but the reason for it is that it has a bit of an antiviral component to it. So it is actually working. It is actually helping. And so that is a phase of it. And then there's also a third phase of COVID. And that's the clotting phase. Okay. So for some people, not all people, but for some people, they're going to have, you've heard of people developing blood clots, developing what we call microclotting. And that's where, the aspirin comes into play. Some people who have a clotting disorder or whatever, they may actually go on, a stronger blood thinner during that time to prevent clots from forming. But basically, we've had great results. We've done really well across the board treating patients in our practice. And I really think the key is treating early. So I would encourage you, if you listen to this and you find that you come down with something, get in touch with your provider and get early treatment because it does make a difference in terms of the course of the condition. And, the other thing is, even if you've had, you've already had it, okay, you can get it again, okay? I'm that person that didn't think I could get it because I had it in January. And sure enough, I let my guard down. I didn't take the precautions and I did get another variant. So anyway, just be careful out there. And, I think that the povidone iodine nasal swabs, that's a great idea to do that. And just be on guard, boosting your immune system and just, not making sure that you're getting adequate rest and doing all the things that you guys know to do to keep yourself healthy and to keep yourself safe. So anyway, that's pretty much it on the COVID, you guys. Just, stay healthy, be well. I really appreciate your time today. I appreciate you plugging in, and, this may be something that ends up helping somebody else. Who knows? So thanks so much for joining me today, and tune in next week as we cover that topic that I mentioned last week we'd cover, which is hair loss. We have a lot of people who are struggling with post-COVID hair loss, just stress hair loss, hormonal hair loss, you name it. So we're going to kind of dive into that. So thanks so much for joining me, everybody. Have a great day. I hope you enjoyed that episode. For more information, visit me at deannaholdren.com. Find me on Facebook, Instagram, and Twitter at Dr. Deanna Holdren. I really want to hear from you, so message me. I love taking your messages and creating topics from them. Please rate, review, subscribe, and share my show with those who have an interest in health and wellness. Thank you for tuning in, and see you next week.